Changes are happening here at the ACR. Our new website is live, and along with it is a new membership model, redesigned with simplicity in mind, streamlined with meaningful benefits for your career journey. Our new membership model is not only for you individually, but also for your team of 4, 6, or even 15 rheumatology professionals. Learn more at rheumatology.org. ACR and ARP, where membership means excellence.
Welcome to ACR On Air, the official podcast of the American College of Rheumatology, where we have engaging conversations with leading rheumatology professionals on topics such as the latest research on rheumatic diseases, solutions for addressing practice management issues, legislative policies impacting patient care, and more. Here's your host.
Welcome back to another episode of ACR On Air, the official podcast of the American College of Rheumatology. I am your host, Dr. John Hausman. Show notes for this episode can be found at acronair.org. You can also find our previous episodes on Apple Podcast, Spotify, and on your favorite podcast app. Research has always been the cornerstone of medical advancement, but for far too long, patients were often seen as recipients of care rather than active participants in the research process. However, a paradigm shift is currently underway, fueled by the understanding that patients bring invaluable perspectives, experiences, and insights to the table. Patient involvement in the research process can help to set priorities and establish the most important research questions. It can improve study design and recruitment, enhance the participant experience within the research study, and help to disseminate the results of this study. Today, we have the privilege of speaking with a guest who's at the forefront of this movement. Dr. Emily Sirotich is a patient partner who has worked with patient organizations, researchers, and pharmaceutical companies to improve their research studies, and she has helped other patients do the same. Dr. Sirotich is a health research methodologist and clinical epidemiologist. She graduated with a PhD in health research methodology from McMaster University in Canada, and I guess she liked this whole clinical research thing that she decided to go back to school and is now a rising second-year medical student at the Yale School of Medicine. Enjoy the show. Emily, welcome to the show.
Hi, John. Thanks for having me. I'm really excited to talk to you today.
Awesome. So tell me about your journey from being a patient and how you became involved as a patient partner in research.
Sure. So I, as a child, grew up with having different experiences in the hospital system as a patient. And it was something that I was just thrown into. None of my family members are involved in medicine or in the healthcare system. So it was definitely a new world for me. And I think one of the things I took away having those experiences as a child is there's such a big community here of people who like to share their experiences with others, support each other, help others, answer their questions. And as I, grew up and started my education, went into university, college, did my bachelor's, I was realizing, wow, people can use their previous experiences to really help them learn and grow and create a career out of that. And, I wasn't actually putting those two things together, but I was really interested in science because of all of my past exposure. And so at that point, I said, let me just pursue the science career. Let's see how it goes. And just little things would come up along the way of, wow, these amazing patients have all of these stories to tell and lessons that they've learned that they're sharing, not only just with me, but with other patients or on social media. And so that kind of brought me to joining the Canadian Arthritis Patient Alliance as a board member. And I said, I really like to learn from these people who've done amazing things, have so many accomplishments. And that was in January of 2020. So I started there to try to learn what it means to actually use all of your experiences to help others and advance science. And then the pandemic hit. So that is really what led me to really learning what patient engagement means in research and my introduction to research. And then we can talk about the pandemic too.
Interesting. What you mentioned just struck me that, you've probably had decades of experience about your disease. And when you think about, physicians, I may know about that disease because I studied it for, a couple of hours in a couple of settings. And how often, we don't realize those differences, right? And we sort of say, well, because I went to medical school and I read a couple of journal articles, I know what it is to live with lupus or rheumatoid arthritis or gout or JIA. When the patients sort of live within those conditions for years and years on end. So, who's the expert? The patient or the physician? Maybe we have different expertise.
I like to think of it as both of us. And
Yeah.
that's, I think, the most beautiful thing about this research and collaborating and bringing all of these skill sets to the same table and the same team is that we learn different things and we're able to put those together to make magic. And I think that's what's important. And that's what I learned. And it took decades to learn that too. So it's really important for me to tell other people, look at this amazing thing that we can accomplish when we work together and put all of our experiences. So patient partners usually call all their experiences their lived experiences, what they've lived through, what they've learned through. So those lived experiences with like all of the educational background and training of these physicians who've done amazing work, who've pursued different careers and different specialties, but been able to really advance science. And if you put it together, it just creates a new perspective that really changes the way we approach research, but also can approach patient care.
Yeah. And I love it. And I love your sort of your desire to first, your understanding that because you've lived with the disease for so long, you are sort of an expert, and your desire to help others, with similar conditions. That's really fantastic. And then others sort of one-on-one with advocacy, but others also in terms of research. So yeah, I remember, March of 2020 and how crazy that was. And early on there was the development of the COVID-19 Global Rheumatology Alliance, and I think as part of that, somehow it was decided that we needed patients involved in sort of the steering committee in order to do better research. So tell me a little bit about sort of what you thought your role was and what it ended up being, for the next 3 years.
It became an adventure and a learning experience and an amazing opportunity. And honestly, it was really amazing to see how it evolved. So basically, from what I experienced or what happened with my involvement and introduction to the COVID-19 Global Rheumatology Alliance, or I'm going to say GRA, I remember messaging the steering committee chair on Twitter saying, hi, I see all of these rheumatologists who want to band together and figure out what the impact of COVID is on their patients. I think it's so important to have patients help you too, because that would be the best way to learn about a disease or this new virus together. Because what it was really unique was that at that point, we all knew the same amount of information about COVID.
That's a good
And
point.
so we were starting with the same knowledge, and what we came at it with was different perspectives. So I said, we should definitely have patients involved. I'm happy to help. Let's get a group of us going. I know many people who would love to help you and try to get an understanding of what this COVID is and how it's impacting patients globally. So I remember I started on Twitter and then grew to Slack and our channels and having discussions as a group. And then eventually I was approached to join the steering committee and help bring the patient perspective and really just focusing on how to engage patients in the organization onto the steering committee. And that's where we met John. And I had the amazing opportunity to collaborate and really have a voice for these patients around the world who may not be having that opportunity to sit at the research table or the table of an organization with other researchers, scientists, physicians, and put our ideas and our voices there so that at the beginning, of these projects, we are speaking about what's important to us.
Yeah, and that's something, having participated in clinical research prior to the pandemic and to the GRA, I have to admit that when I did ask patients for their feedback about the research study, it was usually at the end. So, we had a survey and it was like, hey, can you take a look at this survey to see if it makes sense? And I had no idea that, maybe patient involvement should have started sort of at the beginning, right, of these projects, in thinking about, well, what it is that is important to patients that we should study, right? Because if we're studying, something that really has no, relevance to patients in their sort of daily lives, maybe it's not so useful.
Exactly.
Let's say I'm a researcher and I want to do a new study about, familial Mediterranean fever, which is, one of my favorite diseases. Let's say it's a clinical study. So where do I begin? How do I try to get patients involved in that? Where do I find them? And what should their role be in those initial stages?
That's a great question, and one I hear pretty often. And I'm always excited when someone asks me these questions because it means you're thinking in the right way, which is, how do we involve patients so this project is the most meaningful to the clinically, to the scientific community, but also to patients and their clinical outcomes. So to answer your question, really what you want to do is come up with your idea, run it by your team of who you would normally involve in a research project. So you have, research coordinators, research assistants, you have your statisticians, and in that team, you are now inviting patient partners. And what does that mean, or who are these patient partners? Well, it depends on where you're looking or what you're looking for. So my go-to response to how to find the patient partner that is best fit for you is thinking about patients you've worked with in the past, thinking about patients who are in, maybe your clinics or in other research groups who have some similarity with the topic. But most importantly, I think, to me, is networking in that community for that disease. So there's so many patient organizations that are set up already for specific diseases because that's their way of support and learning and getting information and sharing it back. So being able to go to those organizations and say, hey, I really want to start this project. This is what we're thinking. These are our questions we were hoping to answer as a huge project, research question, not a specific survey question. Can you help? Do you have any insight? And they would be so excited to get involved and be able to come up with questions and approaches that would best get information from patients, but also from other scientists or the community.
Got it. So it should be really early on. And do you see them, you call them patient partners. Do you see them as participating in all of the aspects of the research process, sort of developing the methods? And what do you think would be the benefits of that, patients trying to get involved, early on in those studies?
Good question. So definitely patients can help and should be involved in the beginning of what's the project that we're doing, what's the idea that we really want to approach, what's the real question that we're trying to answer, and what's the best way to answer those questions. Is it through a survey? Is it through a cohort study, a chart review, a systematic review, and being able to see what would patients recommend to get answers to that question. So that would be definitely throughout the whole project, even in the analysis. You have this data or you have your proposed analysis plan of what you want to answer. You can even ask patients and see what their input is on, is it relevant that we're looking at, the elderly versus young adults for this question? And they're going to say yes or no. But it comes down to, do they think that's a relevant question? Is it actually useful for them to know? And that's really what your project's all about, is patient outcomes, what's important to them, and then learning more about the disease and how to treat the disease. So where do we find that information? Back to the patients. Yeah. So they should be involved throughout the project is my answer.
Yeah, that's great. And I wonder if you've encountered, some researchers that may be hesitant about this approach is like, well, I have a master's of, in clinical research, and I know all the data. I know what I want to try to study. Why do I need, a patient who, I think is uninformed and, doesn't really know about research to be telling me what I should be doing?
Yeah, good question. And I think the answer to that is, why do we have collaborators in research at all? Why even have a team? Because we all have different skill sets and we've come at it with different perspectives and we're able to improve a project. So, maybe that patient doesn't want to, or you don't want input on the analysis. Run it by your team like you would with everything else. But maybe that's not the strong suit that you're looking for. Maybe it's, wow, I really need some help from patients on how to disseminate this project and get people recruited to be involved. And the best way to learn how to recruit patients is to ask a patient how to recruit them.
That's a brilliant advice. I remember that we had we did a study about familial Mediterranean fever and looking at the microbiome by collecting stool studies. And I now realize maybe it would have been good to speak with patients about how they feel about that whole thing and how to make it maybe less invasive than what we actually did. Yeah, so I totally buy that. So getting patients involved in helping to speak with other patients and recruit other patients about the study and inform others like why they may want to participate in this study, right? Like we're trying to answer the questions that you're interested in, and being able to communicate that I think can be really powerful.
And even going off of that, I think one of the important points is that we're building like a trusted connection here. Where we want to build a relationship with patients because they're the people who will be uptaking and using the information we create through our research, right? But it's not a one-way street. It's not the scientist, the researcher, or the physician just talking to or at a patient. We're having a conversation. Even in, as clinical management, it's a conversation. It's what works best for that patient. And just taking that out of the clinical perspective and putting into the research perspective, what works best for this group of people I'm trying to learn about? How can we have a conversation so that I can improve the way I'm delivering this research, the way I'm producing this research, and how can they get what they need out of it as well? So it's relevant. Because at the end of the day, what will make the most impactful paper or research project or experience is how relevant all of that information will be at the end of the day. And the best way to know that is by asking the people who it will be impacting.
Yeah. You just mentioned about sort of publishing and the end result of this research. I wonder if journals are becoming more interested in the topic of patient involvement. What has your experience been?
Definitely have been. So one of the things that I've noticed, or there's actually two things I've noticed more recently. One, some journals are requiring a statement that indicates how much patient engagement have been involved in the research project from the start. So they're asking, how are you involving patients?
Interesting.
So it's something that's being published and it's required as part of the article now. And number two are these lay summaries that have been included in articles as they're being published. So that's part of the requirement of submitting a paper now, is you have to put it into lay terms so that people in the general population can understand what they're reading. And one of the reasons they want to do that is they're engaging the general population and people who have different backgrounds and different perspectives, including patients. And also, I just know when, submitting manuscripts, submitting articles, engaging with editors, they're really interested in seeing how are patients involved to improve the research. Because, at the end of the day, most of the time, I haven't heard of any of the times where studies may have been hindered by patient engagement. But patient engagement is improving papers, and that's something that they're looking for.
Yeah, I think that's a great point. So not only will patient engagement make your research study more relevant and better, it may actually be required for you to publish some of those findings, depending on the journal that you're submitting with.
One of the things that I wanted to mention too is patients are going to be, sometimes they're participants in a study, But that
Yeah.
is still different from the partner who will be writing up a paper with you, who will be on your research team. So there's no like ethics, problems that may arise if you're doing this, and you're thinking as you're saying, this is my research team. There's no ethical issues. I'm not treating this patient. They're not a participant in the study. I'm not collecting data for them for the purpose of analyzing it. I'm inviting their perspective as part of a team and as a collaborator. And that's something that also is very easy. So some researchers might get a little nervous thinking, oh, this is a patient, they're involved. Now we have to get a lot of ethics board approvals.
Hmm.
And that's not true when you need it, when that person is invited to be part of a team, not a participant.
Got it. That's a great point. So I wonder if you could sort of provide us with some examples of patient involvement within the GRA and within projects that you've had before, and how you think, those projects may have benefited in specific.
Of course. So, as you know, because we've done this work together, so we had created initial survey at the beginning of the pandemic that captured the patient experience during COVID right at the beginning in the first year. So we developed this survey by having patients as part of the team, the research team, coming up with the survey questions, coming up with graphics and communications and dissemination plans, coming up with our analysis and what questions we were even going to answer on our manuscripts, and coming up with everything. And we disseminated that to the world. I think it was in 9 languages, and we had over 12,000 responses globally, which is amazing. I still haven't heard of any patient partnered work that has achieved that type of response and engagement from the community. And I think even just being able to do that whole process with patients was a milestone, but then also getting that type of response and engagement, and for people to be so excited to participate and see the results of the work was amazing, and a huge landmark for putting patient engagement at the forefront of what research will be in the next 10, 20, 30 years. So even just seeing that type of response and then being able to analyze it and see how are they infected by COVID? Were they able to attend their rheumatology appointments? Did they have access to what they needed? So that all that would not have been able to be accomplished without patients who helped us recruit, understand what we're asking, understand their perspectives, and answer those for researchers to know.
Yeah. And, just to add to that, it wasn't, the patients were just as an integral parts of the team as were the data scientists that we had, as the epidemiologists that worked with us, the rheumatologists, right?
Exactly.
Like we built a very large team, with a large part of patient engagement. And you're right, to try to better understand the patient experience. Like, it would be so silly to create a study to understand the patient experience without getting patients involved in
Yeah.
helping us to form the questions and ask the
Yeah.
questions that are most relevant to patients, right?
And one thing that I remember learning through this whole experience, or just like really struck me in the early days, was one of the questions was, oh, we should ask patients if they're able to get their medication from the pharmacy. And I honestly, I had never thought that would be an obstacle that we'd actually have to ask about. And it became such a huge issue in the following months. But knowing at the beginning that, someone had heard something from somewhere, or it was reported within a support group or organization that there were these shortages that were happening, then we knew that's how that was a question we had to ask. We knew that's something that was going to be a problem moving forward. And we were able to be relevant and be on top of all of this information before the rest of the world was still, figuring out what's going on.
That's a great point. Very, very important highlight of where patient involvement was crucial in capturing data. Again, like, as a rheumatologist, I think every time I make a prescription, of course, the patient's going to pick it up, and not realizing some of the barriers that may be there, including, lack of hydroxychloroquine, for instance.
Exactly.
That happened during the pandemic. So when patients become patient partners, I wonder, certainly they have some responsibilities. And do the researchers also have a responsibility to, for instance, include them as authors of the research study? Should researchers reimburse or pay patients for the time that they're spending in research? What are your thoughts about that?
These are great questions, and I'm so glad we're discussing them because it's something that everyone should talk about and be transparent with, because or else, everyone is confused, lost, or things are just, a little bit murky when you start getting started. So at the beginning of every project, I always sit down with my team, including the patient partners, and I say, here are roles moving forward. Do we all agree this is how we'd like to be involved? Some patient partners might want to be authors on patient papers that come out of the process of the project. Some patient partners might not. They might just want to contribute, put their work and their time in, and be compensated, which I'll answer in a second. But they just might not want to have their name on a paper, and that's okay. But that's like every other, collaborator you might have on a research team. If you're collaborating with another lab, they might say, oh, I'm happy to give some advice, but I don't need my name on this paper because I don't want to deal with the editing of the manuscript, for example. But some patient partners are ready and happy to edit, happy to participate, happy to be a co-author on a paper. So that should always be offered as you would any other person on your research team who's contributing to a paper or a project. So that's number one for me. And then number two, compensation. So all of the patients that I've worked with all deserve the compensation for sharing their expertise in what they've experienced. So they've built lives with however many years of experience dealing with a disease, but also dealing with the disease in a community, dealing with the disease with a professional background, and sharing their lived experiences and knowledge with a team to improve a project definitely deserves some compensation. So at the beginning of the project, before it gets started, I say, this is what we're offering as this part of a role, whether it's like, a honorarium or it's a paid position per hour or whatever is worked out with that patient partner and the PI. That should be decided at the beginning. Everyone should be agreed upon and comfortable with it, and then you just move forward on the roles and responsibilities that you've already agreed on. But we're researchers, we're professionals. We know this is how we work with our team. So we just treat our patient partners like any other team member who we're asking to be involved.
I wonder if you have any knowledge about how, for instance, the NIH or other funding agencies see the role of patient partners. We spoke about, that journals may require at least knowledge about patient involvement. I wonder if you know whether, these funding agencies recommend or demand or suggest that patients be involved in research studies.
Great question. So there are actually grants dedicated to patient engagement and involving patient partners in studies through the NIH, as well as some international organizations such as PCORI. So this is something that funding agencies are looking for. They want to see that you're being innovative. They want to see that you're involving patients and informing your project through these experiences. And there's dedicated funds for that. But not only that, when you're in a competition pool, it has been shown that if you have patient engagement within your project, you're more likely to get funded. That is something that they said as a priority within these international or even national organizations and funding agencies, that this is a priority they're looking to fulfill. So it definitely helps when applying for grants to have patient engagement as part of your project plan.
Great. And I guess also including them in the budget.
Exactly.
For their compensation.
Exactly.
So
exactly.
You're not just saying it, you're actually, making it a part of, of your project and plan.
Exactly. And also I know we were talking about more of the funding agencies, but also sponsors or other industry partners are looking for that as well. And they're able to sometimes contribute towards a budget if they see that this is something that has been listed. So even thinking of beyond, organizations towards industry, they also want to partner with research teams that have patients involved.
Talk more about that, sort of the role of pharma-sponsored studies and whether there is any patient engagement within those.
So pharma is probably a little bit more innovative, I would say, in terms of patient engagement. And they've been having patients consult and work with their teams for many, many years. And I've been lucky enough to work with some of those patients before who have experience within industry. And they came and helped with the GRA and worked with the GRA and helped us build our projects in a way that made sense. But they taught me. So really, I think the pharma industry is seeing the benefits of having patients engage at the beginning of a project, have patients say what's important to them, because at the end of the day, everything that is patient oriented, clinical outcome oriented is something that patients have an opinion on. And industry knows that.
Good point. I wonder, so we've spoken a lot about, the benefits for the researcher, for the research project in, getting funded, getting published, having,
Yep.
better data. I wonder, are there benefits for the patient partners that are participating in this research? Is that a good experience for them? What do they get out of it?
Definitely. So there are definitely benefits to engaging with these projects and sharing your lived experiences and feeling fulfilled that you're giving back to this community, but also feeling that you are being respected and appreciated for all that experience that you're contributing through fair compensation and being invited to the team. So from what I've heard from patients, it's really important that they have their opinion heard. It's really important that they can meet other patients and feel supported throughout the project. And that, this is also like a way for us to build a network and a team of support or share information with people we wouldn't have talked to previously. So that's something that's really important, is the networking or community building aspect. But also this is, for some patients, their lived experiences is something they've been building for decades and is another source of income. So some patient partners or, just people in general, they might be on disability programs or unable to work full time. So this is a really important opportunity for them to share their expertise, but also to receive some compensation to help them with their living expenses. And it's a form of income.
And, recently there's a lot of discussion about healthcare disparities. I wonder how you view the inclusion of patient partners in the research as helping to address some of that.
Yeah, definitely does. It's so important to not only involve patient partners, but also to ensure that patient partners from all backgrounds are included in the research. So I gave the example of how I learned that there's these shortages. I might be someone who comes from a certain background, might not have these obstacles or these barriers to accessing healthcare. By having other patient partners involved who are unfortunately experiencing these barriers helps me understand how to overcome them. So to address these disparities, we can't just be sitting in our one perspective, trying to create research or data or knowledge about a group that we're not even involved in. It's so important to make sure that those people who are experiencing the difficulties are involved in the research from the beginning, because we don't know what's going on and we need to know what's important for them that needs to be addressed. So I feel like this is really a core solution to, or attempting to solve these disparities in healthcare, is by engaging with these communities, making sure that they know that we're prioritizing their needs and working with them to solve them.
Yeah. So maybe, do you recommend like more than one patient partner per research? Because
Good
it
question.
sounds like, right? Like if you want to, let's say I'm studying lupus, the lupus experience of a white woman might be different than a Hispanic male, that might be different than a Black older woman. Like, how many do you need?
It depends on what you're hoping to achieve, but
Hmm.
my standard is I always hope for a minimum of 2 really engaged patient partners, because at the end of the day, I want a patient partner to feel supported on a team. I don't want them to feel like they're singled out or they're not able to, voice any concerns, because one of the things that is important to consider is power disparity,
Yeah.
power dynamics within a research team. You have, as you in medicine, we know an attending physician will have a different power or dynamic than someone who's a trainee who just started medical school and is entering a research team for the first time. So just like there's a power dynamic there, there'll be a power dynamic when a patient comes in. So I always make sure there's at least 2 so they have each other and there's 2 voices at the table. And I try to make sure that there's at least representation of the group of patients that we're hoping to study and hoping to involve in the research should be represented within those patient partners.
Yeah. And ideally also within the other members of the group, right?
Yeah,
If
exactly.
you're just trying to study, Spanish speaking patients in some communities, important to have Spanish speaking, physicians and
Exactly.
researchers. And research assistants, as part of the group as well.
Exactly. Or I always use the like the analogy that if you're looking to study a certain city, like you want to know about New Yorkers, I would not be pulling people from California to understand how New Yorkers work or live or about their lives. So similar to that, you want to bring the people from the population you're really interested in understanding into the planning, into the analysis, into everything, so you can understand what best questions to ask them.
Great. So what advice do you have, for patients that are interested in this process and not just becoming a participant in a research study, but sort of a patient partner? Where should they begin?
That's a great question. So, firstly, I'd like to say that the fact that patient partners who are thinking this way, kudos to them for even being willing and able and wanting to get more involved and give back to a community, because that's what it comes down to, is being able to share your information to be able to improve things for your community. I always suggest that patient partners reach out to local organizations for their specific disease or like overarching umbrella of diseases that they're involved in, or other patient partners that they see are involved in different activities, and saying, hey, I'm very interested in getting involved in this. Is there anything that I could help work on? So that would be number one, is outreach to any organizations in your area. And number two is doing some educational little training. Look at some YouTube, I think there's some free courses on what it means to engage in research and what are the basics of research.
There's YouTube videos and courses for patients to become involved in research?
Yeah. So my the board that I was involved with previously, King Arthritis Patient Alliance, for example, created toolkits for patients so they know how to get involved in research.
Wow.
So there are these organizations that we are asking for funding, that we are, trying to engage with, and we really want to get our research to. They are helping to train patients to get involved in the research that we're doing. So there's toolkits, there's videos, there's instructional classes, there's online courses that are available for patients so they can start getting involved and know what they're getting into. So I know sometimes that's a researcher's concern, is how do I know the patient knows what's going on? I'm worried there might be like a barrier for them to participate in this research because they might not know what it means to do research. And these basic toolkits that have been out, if by patients getting involved and learning things early, or they might have so much experience with research, it would blow your mind to see that they've done, 30 NIH grants already. There are patients who have been so involved in this that even if they're learning from the beginning, there are tools to help them understand research, that it should not be an obstacle.
Yeah, that's something I didn't realize, whether, should these patient partners have training in research, they might even be required, right? If you're part of the research team, right? Per like IRB guidelines, all of your members need to, take some certain courses and
ethics courses,
ethics
training.
Courses. Yeah. So I didn't even realize that, they not only would be required, but certainly useful for patients to understand how research is done if it's not something that they've done before.
Exactly. And it just helps also if patients feel more comfortable in getting involved and making suggestions or having feedback. Because if they know what's going on, then they feel less, you might feel like you're able to speak out a little more or be confident in your opinion on what's going on. So I think being able to contact people locally who are involved, getting educated on what's going on and feeling confident in reaching out to team members, I think is really important for patients to feel comfortable and engaging with research.
Yeah, that makes a lot of sense. Any other final advice for researchers? I talked about my study in familial Mediterranean fever. Any other advice about how to keep patients engaged, throughout the process, and how to make sure that, once I recruit them into my team, I sort of keep them involved throughout the research project?
Yeah, good question. So my expertise has been really in guidelines and in project engagement with patients. And what I found is the most beneficial are check-ins. Setting meetings maybe every few months, every 2-3 months, saying, hey, how are you feeling? Do you feel supported? Is there anything that you think needs to be addressed that hasn't been addressed? Do you feel like you have a voice at meetings? Is there anything I can help you improve on? Is there anything that I need to voice for you that hasn't been clear, or hasn't been, vocalized loudly enough that the other team members have heard? I think check-ins periodically, just to make sure team members are feeling supported and that their voice is being heard, is crucial to having a well-functioning team, no matter who's on it, but especially with patient partners. Checking in, making them feel heard, making their opinions feel important, and making sure they feel validated that they are a team member is really the goal.
Great.
Yeah.
And then once the research is published, hopefully, right?
Mm-hmm.
Because you involved patients throughout the entire process. And,
got that funding.
You got the funding, right? You jumped through the hoops, and they made your research better.
Yeah.
At the end, what's your responsibility as a researcher to sort of share these findings back to the communities that helped you to create the research project?
That's an amazing question. So one of the things that people have been asking or thinking about is, we're collecting this data from patients. Who, quote unquote, owns it? And I don't like to think of it as ownership. I think of it as sharing of information. Mm-hmm. And when the patients share their information with us, it's an obligation in my mind, to share it back with them and the importance of that work. So I always ensure open access as much as possible, putting that in the project budget at the beginning, and ensuring papers are open access, creating lay summaries. So ensuring that people who are reading this, who contributed, can understand what we took away from their information and the group's work. Being able to put it into social media so that people can share it, but being very careful with the language so that, we know what's going out into the world about the project, and we know what it means, and we can make sure that it's accurate. So being able to give patient partners or other people on the team dissemination toolkits of, here's the takeaways, here's what we should tell the world about our work, here's how to say it in lay terms so it makes sense and still is accurate. So doing things like that, but really what's most important is sharing the information back to the people who participated. So I always get a list of all of the participants, anonymously, their contact information. I say, would you like to be contacted with the results of this project? If so, here is a separate email that will be anonymous still. Nobody is using this for contacting you. It has nothing to do with what responses you gave or any of your data for the project. And here's our mailing listserv. Feel free to sign up, and we'll send out all the information about what happened at the project and the results.
Wonderful. Emily, I love the project that we created together. We were able to recruit patients, partners into the research process, get our project funded, published, disseminated. Thanks for all your help.
Exactly.
This has been great. And I hope that researchers out there, use this to really get patients involved in their research projects. And I hope that patients listening to this, maybe become interested not only in participating in research as research subjects, but becoming involved in the research process, which I think, at least for me, being part of research has been, really rewarding, over the last few years. So Emily, thank you so much for your time. I appreciate it.
Thanks for having me, and thanks everyone for listening to our story.
Well, there you have it. Having patient partners as part of the research team improves your chances of getting a grant, makes it more likely that you'll be able to publish the results of that grant, and most importantly, makes sure that you're answering the questions that matter. Thank you all for listening, downloading, subscribing to our show, and for rating us with 5 stars, or however many stars you think we deserve. You can find our show notes for this episode at acronair.org, on Apple Podcast, Spotify, and also on your favorite podcast app. Until next time, keep engaging those patient partners. And of course, stay healthy.
Loved this episode of ACR On Air? Then be sure to subscribe at acronair.org.